procedural approach is unique compared to other pudendal nerve blocks for multiple reasons. So comparing the placement of where we're treating the pudendal nerve, the classic for if you're going to a interventional pain doctor under fluoroscopy or guidance, x-ray guidance, they would be putting it between what we call the sacrospinous and sacrotuberous ligament. They're these big, thick ligaments in the posterior aspect of your sacrum. So they have to pop through these thick ligaments and place it in between. We do not do that. The other option that's commonly offered out there is transvaginal through the vagina by a gynecologist, and blind meaning no guidance at all, and transvaginal, blind. So we're not doing that either, and those are the two most common. What we are doing is we're using an ultrasound for guidance, which is better because there's no radiation with ultrasound compared to the fluoroscopy, and our patients are young and we want to preserve their ovaries, so we don't want radiation, so that is why we use ultrasound guidance, and also it allows us to do it in an office without anesthesia. And our approach is we're placing it in a place called Alcock's Canal, and the place that allows us to do a high volume technique and dissect out the fascia and create space. So as well as allows us to access it with a very small diameter needle, a thin needle. So it's very safe and comfortable, because if you have to pop through a ligament, as the other approach in interventional pain would offer, you need a thicker needle to do that. You don't need that. So we were able to use a very tiny, flexible needle and tunnel it to where we want it to go. Safer, more comfortable, more accessible, and in addition allows us to do a high volume, more effective technique. That would be the main difference in our approach. The other difference between the PRM protocol and what else is offered out there is we are addressing something called the cross-sensitization that occurs in the pelvis. So it's a fancy terminology where all the different nerves in the pelvis talk to one another and they're best friends. And so they upregulate one another. So you need to address multiple nerves at once, the ones that have cross innervation, in order to downregulate the pelvis. If you do not do that, they will continuously, even if you treat one, the other one will upregulate and cause pain.